Assalamualaikum warahmatullahi wabarakatuh. Hi, I'm Syahnur Farhana binti Omar from class BM 2355A. As this video, I'm going to present about communication in healthcare organization. For my issues, I choose asymmetrical knowledge in healthcare organization. I would like to briefly explain about the communication. Communication is important in any industries, especially in healthcare organization. Asymmetric information defined as failure in communication or one party have greatest knowledge than another party. For example, it sometimes happens in policy insurance, in context of insurance and healthcare organization itself. As for in hospital, patient knows lesser than the doctor knows, so patient delegate power to doctor to treat them. In health insurance, they have two major problems because of this asymmetrical information, which is it can make two major problems, which is adverse selection. Adverse selection means that when people with higher risk pay at same premium like low risk people. Next is moral hazard. Moral hazard defined as expected loss from an adverse event increases as insurance coverage increase. Policyholder knows better than policymaker loss incurred due to this problem. Meanwhile, in nursing home divided into two, which is public and private. So for public, it mitigate market failure, inherently altruistic. Otherwise, for private, it exploit the information or patient will take advantage. As for recommendation, I would like to recommend a few recommendations such as reduce asymmetrical knowledge among healthcare organizations. Patient needs to have asymmetrical knowledge as well, because when policymakers know about the policyholder status, then they can give or they can suggest premium that should be paid by the policyholder. Next is embed information. This is important for insurance company because they need information to be binding in the contract. Next is monitoring to reduce moral hazard. And finally, screening. This is most important because policymaker need to screen health status of policymaker. As for the conclusion, asymmetric information sometimes give advantage to one party but not for another party. For example, in healthcare organization, it can give benefit to policy. In healthcare, in insurance company, it can give benefit to policyholder. Meanwhile, policymakers sometimes can get lost, can suffer from loss. As for healthcare organization, sometimes patients need to know about asymmetrical information because they need to know what the treatment or procedure given by the doctor, which is sometimes is not necessary to their conditions. Thank you.